Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. The physician orders the administration of high-humidity oxygen by face mask and placement of the patient in a high Fowler's position. After assessing Mrs. Paul, the nurse writes the following nursing diagnosis: impaired gas exchange related to increased secretions. Which of the following nursing interventions has the greatest potential for improving this situation? Option A. Encourage the patient to increase her fluid intake to 200 milliliters every 2 hours. Option B. Place a humidifier in the patient's room. Option C. Continue administering oxygen by high humidity face mask. Option D. Perform chest physiotherapy on a regular schedule. Right answer is Option A. Encourage the patient to increase her fluid intake to 200 milliliters every 2 hours. Adequate hydration thins and loosens pulmonary secretions and also helps to replace fluids lost from elevated temperature, diaphoresis, dehydration, and dyspnea. High humidity air and chest physiotherapy help liquefy and mobilize secretions. The most common deficiency seen in alcoholics is Option A. Thiamine. Option B. Riboflavin. Option C. Pyridoxine. Option D. Pantothenic acid. Right answer is Option A. Thiamine. Chronic alcoholism commonly results in thiamine deficiency and other symptoms of malnutrition. Which of the following statement is incorrect about a patient with dysphagia? Option A. The patient will find pureed or soft foods, such as custards, easier to swallow than water. Option B. Fowler's or semi-Fowler's position reduces the risk of aspiration during swallowing. Option C. The patient should always feed himself. Option D. The nurse should perform oral hygiene before assisting with feeding. Right answer is Option C. The patient should always feed himself. A patient with dysphagia, difficulty swallowing, requires assistance with feeding. Feeding himself is a long-range expected outcome. Soft foods, Fowler's or semi-Fowler's position, and oral hygiene before eating should be part of the feeding regimen. To assess the kidney function of a patient with an indwelling urinary, Foley, catheter, the nurse measures his hourly urine output. She should notify the physician if the urine output is Option A. Less than 30 milliliters/hour. Option B. 64 milliliters in 2 hours. Option C. 90 milliliters in 3 hours. Option D. 125 milliliters in 4 hours. Right answer is Option A. Less than 30 milliliters/hour. A urine output of less than 30 milliliters/hour indicates hypovolemia or oliguria, which is related to kidney function and inadequate fluid intake. Certain substances increase the amount of urine produced. These include Option A. Caffeine-containing drinks, such as coffee and cola. Option B. Beets. Option C. Urinary analgesics. Option D. Kaolin with pectin, kaopectate. Right answer is Option A. Caffeine-containing drinks, such as coffee and cola. Fluids containing caffeine have a diuretic effect. Beets and urinary analgesics, such as pyridine, phenazopyridine, can color urine red. Kaopectate is an antidiarrheal medication. A male patient who had surgery 2 days ago for head and neck cancer is about to make his first attempt to ambulate outside his room. The nurse notes that he is steady on his feet and that his vision was unaffected by the surgery. Which of the following nursing interventions would be appropriate? Option A. Encourage the patient to walk in the hall alone. Option B. Discourage the patient from walking in the hall for a few more days. Option C. Accompany the patient for his walk. Option D. Consult a physical therapist before allowing the patient to ambulate. Right answer is Option C. Accompany the patient for his walk. Accompanying him will offer moral support, enabling him to face the rest of the world. A hospitalized surgical patient leaving his room for the first time fears rejection and others staring at him, so he should not walk alone. Patients should begin ambulation as soon as possible after surgery to decrease complications and to regain strength and confidence. Waiting to consult a physical therapist is unnecessary. A patient has exacerbation of chronic obstructive pulmonary disease, COPD, manifested by shortness of breath, orthopnea, thick, tenacious secretions, and a dry hacking cough. An appropriate nursing diagnosis would be Option A. Ineffective airway clearance related to thick, tenacious secretions. Option B. Ineffective airway clearance related to dry, hacking cough. Option C. Ineffective individual coping to COPD. Option D. Pain related to immobilization of affected leg. Right answer is Option A. Ineffective airway clearance related to thick, tenacious secretions. Thick, tenacious secretions, a dry, hacking cough, orthopnea, and shortness of breath are signs of ineffective airway clearance. Ineffective airway clearance related to dry, hacking cough is incorrect because the cough is not the reason for the ineffective airway clearance. Ineffective individual coping related to COPD is wrong because the etiology for a nursing diagnosis should not be a medical diagnosis, COPD, and because no data indicate that the patient is coping ineffectively. Pain related to immobilization of affected leg would be an appropriate nursing diagnosis for a patient with a leg fracture. Mrs. Lim begins to cry as the nurse discusses hair loss. The best response would be Option A. Don't worry. It's only temporary. Option B. Why are you crying? I didn't get to the bad news yet. Option C. Your hair is really pretty. Option D. I know this will be difficult for you, but your hair will grow back after the completion of chemotherapy. Right answer is Option D. I know this will be difficult for you, but your hair will grow back after the completion of chemotherapy. I know this will be difficult acknowledges the problem and suggests a resolution to it, offers some relief but doesn't recognize the patient's feelings. I didn't get to the bad news yet would be inappropriate at any time. Your hair is really pretty offers no consolation or alternatives to the patient. An additional vitamin C is required during all of the following periods except Option A. Infancy. Option B. Young adulthood. Option C. Childhood. Option D. Pregnancy. Right answer is Option B. Young adulthood. Additional vitamin C is needed in growth periods, such as infancy and childhood, and during pregnancy to supply demands for fetal growth and maternal tissues. Other conditions requiring extra vitamin C include wound healing, fever, infection and stress. A prescribed amount of oxygen is needed for a patient with COPD to prevent Option A. Cardiac arrest related to increased partial pressure of carbon dioxide in arterial blood, PaCO2. Option B. Circulatory overload due to hypovolemia. Option C. Respiratory excitement. Option D. Inhibition of the respiratory hypoxic stimulus. Right answer is Option D. Inhibition of the respiratory hypoxic stimulus. Delivery of more than 2 liters of oxygen per minute to a patient with chronic obstructive pulmonary disease, COPD, who is usually in a state of compensated respiratory acidosis, retaining carbon dioxide, CO2, can inhibit the hypoxic stimulus for respiration. An increased partial pressure of carbon dioxide in arterial blood, PaCO2, would not initially result in cardiac arrest. Circulatory overload and respiratory excitement have no relevance to the question. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.